This is a great question. So surgeons, plastic surgeons in particular, are really fussy about patients stopping smoking, and here's the reason why. So we do procedures where we are removing tissue and moving tissue around, and we even do big procedures where we completely remove pieces of tissue from your body, put it somewhere else, and sew little tiny blood vessels together. So we're altering blood supply to the area we're operating on. So that area is coming from behind at a baseline. So the tissue is not receiving its normal blood supply, which already causes issues with healing. Now, cigarettes do three things which are super problematic for healing. So thing number one is that you're inhaling free radicals, which are damaging your lungs. So there's a few reasons why this is problematic. So reason number one is if your lungs are damaged, they're not moving oxygen into the blood the way that we would like. And so sometimes you're not getting as much oxygen to the areas. That's not so great. The other thing is that while your body's focusing on healing free radical damage, in theory, it's not focusing on healing your wounds. And so that's problematic too. The next thing is when you inhale cigarette smoke, you are inhaling carbon monoxide. So carbon monoxide is going to bind to your blood cells and not allow them to carry oxygen. So it's also going to reduce the amount of oxygen that your blood is carrying, allowing your surgical site to heal. And then the last thing is nicotine. So nicotine is a vasoconstrictive. It constricts blood vessels, and that can reduce blood flow to the areas that are healing as well. So all of these things are just bad for healing in general. And you throw on top of it that you're doing this when you're already trying to heal a procedure that can be problematic at a baseline, and you're just asking for trouble. So in general, the cosmetic procedures that you will hear plastic surgeons be like, no, absolutely no smoking. We're really particular about it. We're going to test you for nicotine, are going to be facelifts, breast lifts, breast reductions, and tummy tucks. Those are the big ones. Any type of lifting procedure, we're often removing tissue and rotating tissue, and this is a setup for problems with smokers. Now, I will say I would like every patient to stop smoking. And so I try really hard with my patients who are smokers that are motivated to stop smoking for surgery to continue that afterwards, because there's so many benefits, of course, to not smoking. Not only is it healthier to not smoke, it's less expensive. You're saving money, you're protecting your surgical result. There's so many reasons to stop smoking. So I'm a big advocate for trying to get my patients to stop altogether. I know that's not always in the cards. So for after surgery, you want to make sure that you do not smoke until you are well healed. That can be 3 weeks, that can be 3 months. It really depends on what the situation is. So I make my patients stop about 6 to 8 weeks before surgery. And the reason why is because it often takes a few weeks to get going if you're a smoker, because it's not easy to stop. And then I want you to stop for at least 1 to 2 months afterwards, maybe longer if you're having any type of healing trouble.